Welcome to our anatomy presentation by Chloe, Callie, Charlotte and Rachel. So we're focusing on a releve to a pirouette in a retiré position. So a releve in dance is an important position to maintain and master. This allows the dancer to prepare for any jumps that they may be performing and have strength and control at the same time that they may need in any other dance movement. In their whole practice, they need strong ankles for certain movements. Now, pirouette in dance is another essential thing for a dancer. Once they have mastered a pirouette, this will help and set them up for any other turns that they may have to do in the practice. It also allows the dancer to focus on their balance and control throughout the movement, which again helps them with other movements throughout the dance practice with the control from the pirouette. Anatomy of the releve. So key joints in the releve is the ankle, the knee and the hip. The hinge joints are the ankle and the knee, and then the ball and socket joint is the hip. So when a dancer is performing a releve, they will rise onto the ball of their foot, or if in the case they were a ballerina, they would rise onto their demi-point. When they rise, this will tend to be a concentric contraction as the muscles will be shortening when performing this movement. So when they are in this position, they will need to have their strong ankles to prevent them from wobbling and falling out, meaning they will have control when in this still position. Anatomy of a retiré. Again, the same joints are ankle, knee and hip, which are hinge and ball and socket. So the hip is only connected by the femur and the pelvic bone. The knee is connected by the femur, tibia and the patella, which is the kneecap. The ankle is mainly crested by three particular bones, the tibia, the fibula and the talus, which is in the foot and the ankle. So when a performer is performing a retiré, the dancer mainly uses the leg and the foot muscles, helping them to pull up towards the knee and the supporting base leg. This demonstrates the contraction of the muscle in the hip, thigh and calf, which focuses on the gluteus maximus, hamstrings and quadriceps. So again, they'll need that to be strong to prevent from wobbling, to keep control in the core, but also have that control in the supporting base leg to prevent them from wobbling out of this movement. Now, when a dancer is performing these movements, alignment is important for when the dancer is performing these, as again it maintains the strength, stability and injury prevention. Proper alignment ensures that the dancer's weight is contributed correctly, meaning the dancer can move with control. So if they have the correct alignment in these movements, it will prevent them from injury, meaning that they can carry on with their dance practice, as if the weight wasn't contributed correctly, it could lead to them having too much weight forward onto that ankle or too weight back, which will then cause injuries, meaning they can't carry on with these movements.
Okay, so moving on to the muscles. So before the dancer can actually do the releve, they need to be in first position first. So to do this, the gluteus maximus and the deep six needs to isometrically, they need to concentrically contract to then isometrically contract and rotate and maintain the legs internal, as these muscles are responsible for controlling the legs' internal and external rotation, said by Thompson in 2019. To actually begin moving into the releve, the quadriceps have to eccentrically contract for knee flexion to achieve that demi-plie, whilst the quadriceps contract, the calf muscles such as the gastrocnemius additionally eccentrically contract to keep the heels planted and dorsiflexed on the floor, as this is a muscle that is a secondary mover for knee flexion. Moving from knee flexion to knee extension and then from ankle dorsiflexion to plantar flexion, the ITB is also known as the iliotibial band, contracts as a part part of a knee extensor from 20 to 30 degrees of knee flexion to extension, alongside the quadriceps that begin to concentrically contract, followed by an isometric contraction to then hold the knee in that extension while the dancer is on a rise. Whilst the quads change their contraction, the gastrocnemius and the soleus additionally concentrically contract to bring the foot into plantar flexion and releve the feet. The tibia and fibia are also muscles that assist this too. And then finally, for the releve, the FHL muscle concentrically contracts for plantar flexion and then isometrically contracts to hold it in place. And then for the actual pirouette and retire position, I'm going to be talking about the left leg being the supporting leg and the right leg that's coming up to the retire. So for this, the quadriceps, which are the antagonist in the left leg, isometrically contract to hold that knee in extension whilst the dancer is turning. The gastrocnemius in the left leg also isometrically contracts while in a concentric contraction to hold that releve as long as possible to allow the dancer to do as many turns as possible. The hamstrings on the right leg concentrically contract to pull that knee into flexion, whilst the quads in the right leg then eccentrically contract as the opposite muscle. The gastrocnemius, which is also the antagonist, concentrically contracts to point the foot into plantar flexion, as you can see on the image. The glutes then finally isometrically contract to hold both legs in turnout, but only the rectus femoris in the right leg contracts as a hip flexor to pull the knee and thigh up to 90 degrees. Obviously, if it was higher than 90 degrees, it would change to the iliopsoas, but as the dancer is turning, those muscles then all as a collective stay isometrically contracted.
When referring to alignment in a releve, the base of support is the balls of the feet, whilst the centre of gravity must remain directly above this to maintain balance. The plumb line falls straight down the body through the head to the feet so the alignment is maintained. To help prevent falling off balance, the ankles play a crucial part in maintaining the alignment as they constantly move to maintain this and prevent rolling over. If this does happen, injuries can begin to form, especially if it's performed with improper technique. To maintain this, the hips must also remain in a neutral position, as sinking or lifting can cause an imbalance by pushing the centre of gravity out of line with the base of support. Alongside this, the pelvis can tilt in an anterior or posterior position depending on the anatomy of the individual. From this, the misalignment of the centre of gravity to the base can be affected as the plumb line no longer remains perfectly straight. In a pirouette, many similar issues can affect alignment, such as the plumb line. This should remain in the same position as a releve, where it begins at the top of the head through to the foot. However, the base of support is greatly reduced. When turning in this retire position, the body must make multiple smaller adjustments as the action occurs so the alignment is maintained. Ankles play a great part in balancing a pirouette, as any great movements can create a rolling motion of the ankle, which can cause injuries to occur as well as falling off balance. Similar to a releve, the pelvic tilt can affect the turn by pushing the individual's centre of gravity forward or back, moving it from being directly above the base of support. Abdominals play an important role in a pirouette as a stabiliser muscle, helping the turns to be controlled so that the alignment remains along the plumb line and multiple turns can then be performed by maintaining this.
On this slide, I'll be talking about ankle stability, which leads to performance enhancement. While strength and technique in the hips and core are crucial, one of the most important factors is a strong base of support, building a stable and supported base, starting from the ankle joint. Ankle stability plays a vital role in helping dancers achieve a higher releve and retire positions. Without it, we risk instability, inefficient movement, and even injury. One of the key focuses is strengthening the relationship between the talus bone and the heel. This connection provides the foundation we need when rising onto releve. The gastrocnemius and soleus muscles, along with the lateral lower leg, must work together to pull us up into position and, just as importantly, to control the descent back down. When performing a releve position, focus on centering your weight over the second and third metatarsals. This keeps the ankle in alignment and provides a strong base for any movement in releve, preventing potential injury due to the ankle rolling outwards or inwards. One exercise I found to work to enhance performance would be using a small ball, tennis ball size or slightly bigger. Start in a parallel position with the small ball placed between your ankles. Maintain neutral alignment and slowly rise onto releve while applying light pressure to the ball in between your ankles. As you rise, align the middle of your talus over the second toe. Hold this releve position for 4 counts, then control your movement as you return to neutral. Repeat this 20 times. This simple but powerful exercise activates both the soleus and gastrocnemius, building strength and improving the movement in itself. Overall, to enhance your releve and retire, focus on ankle strength and alignment, reinforce the talus to heel connection, engage the lateral lower leg, gastrocnemius and soleus, avoid sickling by centering your weight properly, incorporate targeted exercises like the ball releve to build stability and control. Improving ankle stability won't just elevate your technique, it will also help prevent injuries and create more efficient alignment and an elegant line. Furthermore, releve exercises are essential to building stability in pirouettes because they strengthen the calves, ankles, and core muscles, crucial for balance and control. By consistently practicing releve, dancers improve alignment, learning to stack their shoulders, hips, and supporting foot in a straight line, which is crucial for staying centered during a turn. Releve also trains muscle memory for the push-off and rise into pirouette while enhancing the movement. Over time, this increases control, endurance, and the ability to execute clean and stable turns. Practicing releve in retire position makes the connection to the pirouettes even stronger.
A releve to pirouette can damage the Achilles tendon by putting great amounts of pressure upon it. This can be very impactful with improper technique or training, since the build-up of stress on the area can form a serious injury that can affect or prevent many future performances from a dancer. Alongside this, an injury may cause an individual to dance differently and put stress on other areas of their body to compensate, which can lead to more forming. Many injuries can occur in the ankles since the base of support is minimized in both of these movements. Balancing is therefore a harder task, causing the ankles to constantly move to maintain this. As a result, losing this balance can lead to many injuries, such as sprains, due to the rolling motion that can occur when the balance is lost. In a pirouette position, the leg in the retire position is in a turned out form. As a result, individuals who don't have the flexibility, proper training, or correct anatomy for good turnout may try to overcompensate by turning out from the knees and ankles rather than the hips. Because of this, the ankles and knees are overworked and therefore become damaged over time. This issue can also form an anterior pelvic tilt over time, affecting the core and inner thigh muscles. This can affect alignment as the core is greatly used in a pirouette for stability, which can lead to more issues occurring from overworking other areas to help compensate. The hip flexor can also tighten as a result, preventing turnout, causing injuries from a forced turnout to become worse as the knees and ankles are used even more.
Right, we're going to move on to the conclusion. To conclude, in a releve... Now we're going to be moving on to the conclusion. To conclude, in a releve to pirouette, different joints and bones are used in each stage to help bring the overall movements together. By not having strong joints and bones can impact the dancer by leading them to resulting in injuries and impacting their dance practice.
Overall, for the muscles, partially the lower body, are significant for releve and pirouette as they enable the dancer to flow through the movement with ease and create the needed positions with stability through their contractions. It's important to keep these muscles in shape and healthy, as even one muscle that's out of health can affect the dancer's ability to perform a pirouette and other movements.
To summarise, the alignment of the body greatly impacts how a releve and a pirouette is performed, as it allows control and stability. Overall, a key factor to build upon and enhance your performance for this exercise is to strengthen your ankles and lower legs, as it helps with stability, alignment and balance.
And finally, the alignment is also important as major injuries can occur if alignment isn't maintained, which can either impact how the individual dancers, possibly injuring them further, or prevent them from dancing altogether.
Thank you.
Thank you for listening.
Now we're going to be moving on to the conclusion. To conclude, in a releve to pirouette, different joints and bones are